So what I would like to know is what makes Lyme disease so difficult to diagnose early in the early stages?
Okay, so there are really two questions in one question. To answer very simply is to say that it takes time for the body to produce antibodies. And everybody agrees. We know there is a controversy over Lyme disease, but there are some points where there is no controversy. And the
Mm,
CDC himself warned that don't do a blood test within the first 2 months of a tick bite because the chance of having a blood test positive is so low. It can
mm,
be misleading. The second point that I would like to emphasize is that there are basic rules of medicine that are not really taken into consideration with Lyme, and we will see that over this podcast. The first consideration is that if you want to do a diagnosis of infectious disease, you do a culture or you do a
yeah.
PCR. If you have a sore throat, you don't give your arms for a blood test. If you have a UTI, you don't give your arms, you give urine. If there is a wound, you do a culture. So why we don't do that with Lyme? Because where do you want to park your swab? Can you do a can you drill a hole in the brain to do a brain culture? You cannot do that. Lyme can be everywhere, can travel all
Mm,
over the body, can be in the muscle, in the heart, in the brain, so in the liver. So where do you want to do a culture? It's just impossible. Sometimes
mm,
it's possible because people have a joint effusion, but most of the time it's not possible. So we have this um, this second choice uh, diagnostic tool, which is a blood test. And since we do that all the time, it becomes routine. We forget that it's a second choice test. And this is the reason why it's so difficult to diagnose Lyme, because it's difficult to make antibodies at the beginning of the Lyme disease, but afterwards it's not so easy either. The
mm,
Lyme disease is an immune suppressant disease. The Lyme bacteria play games with our immune system, and many people are not able to make antibodies to
mm,
the point that, ironically, I can tell you that Lyme doctors who have lots of experience will tell you, sicker you are, more chance you have to have a normal blood test. And if you show up to my office with 10 positive bands, I smile silently, but I know it's not Lyme. You are too healthy to have Lyme. So it's just the opposite of what people may think. Why? Because Lyme is immunosuppressant. It's like taking a drug that is immunosuppressive drug, and you check the antibody to see if the drug works well. It's a nonsense. So
mm.
blood test is not only difficult early on, is always difficult. It's just that early on everybody agrees about this.